All right, good morning, everybody. My name is Chad Bates. This is my co-presenter, Nikita Patel. We're both second-year students at NOVA, Southeastern University down in Fort Lauderdale, Florida. And today we're going to be talking to you about gene therapies and the treatment of Parkinson's disease. And as many of you know, Parkinson's disease is one of the more prevalent neurodegenerative diseases, especially among the older populations, with the hallmark symptoms being those of rigor, tremor, and bradykinesia. Those are almost always caused by buildups of alpha-synuclein proteins into Lewy bodies within the brain, and also the loss of dopamine-producing neurons within the brain as well. As of now, the gold standard for treatment of Parkinson's disease is levodopa, which is a dopamine agonist. But unfortunately, its use is only to mask the symptoms of Parkinson's disease. It doesn't halt the progression at all, which is where these gene therapies come in. We're hoping with further studies, including some of these below, which we'll get into, we'll be able to do both halt the progression of the disease and treat the symptoms. So we'll start with some of these gene therapies that we're focusing on today, the first being CDNF. But before we can talk about CDNF, we have to talk about GDNF, which is the gold standard for neurotrophic factors and the gene therapies related to Parkinson's disease. The gold standard GDNF has been effective, but it does come against some roadblocks along the way, those being side effects and the fact that it does require some invasive intracranial surgery. We're hoping that we can work around some of these roadblocks with CDNF, because with CDNF, it only targets dying or stressed neurons within the brain. It doesn't target the healthy, naive neurons like GDNF does. And as you can see in some of the preclinical animal trials, we were able to see some modest neuroprotective effects in our rat models, as well as some restoration of the neurons in those rat models. So working off of that, we moved on to clinical trials with CDNF, where we saw 60 to 75% putamen coverage, which was a significant increase from GDNF, the gold standard. So that was promising, making it seem like it's a little bit more brain specific. There was also increases in DAT-PET signaling, as well as improved UPDRS scores, which is just the standard scoring system for Parkinson's disease. As of now, though, unfortunately, even with these promising effects, it's not quite up to par with what's already clinically available. So there are future studies ongoing now to hopefully bridge that gap just a little bit. Another one we focused on is VEGF, or vascular endothelial growth factor. It hasn't quite reached clinical trials so far, but in the animal trials, in the rat models, we do see alleviated amphetamine-induced rotations within those models. We have decreased dysregulated movements and improved survival of the Th-positive neurons. And while those are helpful, unfortunately with VEGF, just because of the vascular permeability effects of this growth factor, there were some unwanted side effects as well, those being angiogenesis and some other blood-brain barrier disorders. So as of now, it's only animal trials, but we are trying to get into the clinical trials and remove some of those unwanted effects. Other ones that are newer include the heat shock protein 70, the FKN, and the BDNF. These are all relatively new within the last couple of years, so we still are in animal trials. They had similar positive results within those animal trials, as you can see, things like long-term expression in the substantia nigra, improvement in the motor behavior symptoms, things along those nature. And we're hoping to build off of that momentum and take that into the clinical trials moving forward. And I'll let Nikita take over the rest.
So I will be continuing the conversation with AADC, which is another gene therapy vector that was used in this review. And AADC has been shown to improve on-time UPRDS scores, as well as increase dopamine concentration, as well as AADC enzyme concentration in the brain. One of the reasons why AADC was so significant is it was the only study that followed a 36-month time course for clinical trials. And that allows us to evaluate the long-term efficacy of this treatment And considering gene therapy is a new and emerging field still to treat Parkinson's disease, it is important that we follow a longer time course to evaluate potential side effects. And another target was GAD, and GAD also improved UPRDS scores, improved on time, as well as reduced levodopa-induced dyskinesia. And levodopa-induced dyskinesia is a side effect of current pharmacological therapies that a lot of Parkinson's patients do have to, unfortunately, suffer from. And GAD is shown to reduce that. One of the reasons why GAD is so significant compared to the other treatment modalities is because it takes a non-dopaminergic restoration pathway by modulating STN overactivity. So it employs a new sort of avenue to treat Parkinson's disease, and maybe it'll help me bridge the gap in the understanding of Parkinson's, and it can treat a broader range of people using different treatment options. And lastly, I will be talking about GDNF. And GDNF, as my colleague mentioned, although requires an intracranial approach, it does have its benefits in that it decreases off time, improves on time, it increases dopamine concentration in the brain, as well as it also provides neurotropic and neuroprotective effects on the brain. So it has been shown to improve, the protection of dopamine neurons that are existing, as well as the newly formed dopamine neurons. And whether we're talking about BDNF, CDNF, GAD, or FKN, or any of the gene therapy vectors that you see up on the board, a lot of Parkinson's disease is still unknown, and we do need further research, and a potential future direction for this experiment would perhaps be employing a cocktail mixture of using various different gene therapies to treat Parkinson's as a whole, because it is a multifactorial disease. So I think that's a future direction that does need to be further explored. And we'll take any questions.
Questions? No questions. Thank
All
you
right.
all very much.
Thank
Thank
you.
you.